Over the weekend, health officials in Barbados indicated that there were 10 cases of fully vaccinated people testing positive for the virus.
The public wants to know, are people getting COVID after they've been vaccinated? So once a week, the province is reporting breakthrough cases, when a person is COVID positive 2 weeks after receiving either 1 or 2 doses of vaccine.
The Richmond Henrico Health District is working to find out if COVID variants are responsible for fully vaccinated adults contracting the virus. Virginia has seen 71 hospitalizations in fully vaccinated individuals and 17 deaths.
How many infections in TNT of COVID-19 have we seen in fully vaccinated persons?
Not everyone who has a COVID-19 positive test captured also has their vaccination status captured. And therefore, it's difficult to say with any certainty how many people have been fully vaccinated and yet still acquired the COVID-19 infection. That's not something that we really have an easy way of tracking.
I'm a doctor for 46 years, and I've attended to over 120,000 patients in my life. And I have 31,000 private patients in Trinidad, or even more. And I can't recall losing a patient on the operating theater table or losing a mother at delivery. And for us as senior doctors, you ask any one of my colleagues, 1 death is too much. But here we have 1,000 people dying and nobody's asking anything. I find it bewildering. Has anybody asked and gotten the answer? How many people really survive in the ICU?
On the issue of Dr. Tim Gopi Singh, the less said about him, the better.
When Minister Dayal Singh doesn't even know what is the national anthem, what do you really expect?
This national anthem is discipline, production, and tolerance.
I think we have to have a lot of that to tolerate Minister Dayal Singh, discipline, production, and tolerance.
Together we aspire, together we achieve. That's our national anthem.
I have a habit of putting my foot in my mouth. Social media is causing more damage than coronavirus at this point in time. I have a habit of putting my foot in my mouth. We have social media. We have our website. Please go to these alternate modes of communication before going to the COVID-19 hotline.
I want to give some advice to my 4 medical colleagues who come on television every day, whom I had the privilege and pleasure of teaching 3 of them at various times. COVID-19 hospitalization in England surveillance system. Have you heard about it? They collect data on patients with COVID-19 admitted to critical care. This research findings assist and guide, 1, advances in clinical management. But I know that all 3 of you have not worked substantially long in hospitals. You went on from being an intern to a house officer, and you went in training in public health. But hospital experience need to be taken into consideration. Get some help, Dr. Trotman, get some support. My understanding is that you are in charge of all the admissions and management and transfer of these hundreds of patients on a daily basis. How can one person be managing that? And where is your research to help you in further clinical management? Reduction of strain on critical care services. What is the research being done in Trinidad? Evolving research findings have been central to informing and improving treatment. Evolving research findings, where is that being done in Trinidad and Tobago? There is an undeniable association between critical care staffing, service strain, and patient mortality. Is this happening in the ICUs and in the HDUs? Pharmaceutical treatment and management. And a lot of pharmaceuticals and reagents necessary for testing are not available in this COVID-19 pandemic time. So what do you expect? Don't you expect the patients to die? What about the D-dimer tests? Where are your vasopressors to keep the heart beating stronger when patients' hearts are failing as a result of being in the intensive care unit? There is a significant impact of critical care organization when you do your research. And there are models of nursing care delivery. Have you looked at that? Have you implemented that? The improved survival of critical care COVID-19 patients is consistent with recent research. Where's your research? How many patients are dying? How many come out alive? Why do they die? There is significant research being done internationally on critically ill patients that help to guide clinicians understanding the evolving outcomes of patients in order to improve and undertake further targeted clinical management in ICUs and HDUs. Sadly, painfully, no analyses, doctors, no statistical data available, nothing, Honorable Minister of Health, Honorable Prime Minister, nothing. Where are we? Are we a Z-world, in a Z-world country? We have bright brains. We have some of the best doctors in the world here in Trinidad. Bring them together, ask them for some support. But you are an autocrat and you get up on television every Saturday and tell the country, well, X amount of vaccine coming and they don't come and X and Y. And the doctor's telling you about this graph and that graph and this color graph and how many beds available and how many beds filled. We need important information. An analysis done worldwide on intensive care unit strains and mortality risk among critically ill. Critical care survival rates in COVID patients important. Mortality in patients admitted to ICU. What factors are associated with increased mortality? ICU and ventilator mortality among critically ill patients, and studies linking hospital ICU capacity to COVID-19 mortality rates. There have been meta-analyses of data, doctors, on Medline, Embase, PubMed databases have published data on deaths in intensive care as a proportion of completed ICU admissions. Observational studies including 43,000 patients, and they show that ICU deaths range from 10%, 1 in 10, and in most countries you have maximum of 3 out of 10 dying. What is ours in Trinidad and Tobago as deaths as a proportion of completed ICU admissions? We have no information, none. Who from the medical team of advisors can provide this information? None has been doing it. Now, doctors, why? Is it incompetence? Is it unwillingness to have that information available? I have been advised that at least 8 out of 10 admissions in our ICU die and pass away, unfortunately. Have we asked at all why has there been a surge in deaths over the last 80 days? And how many of the lives could have been saved? Did they all have to die? Could their deaths been prevented? We have been asking for months for information related to that from the 4 doctors, the Minister of Health, the Prime Minister, and can they account for the deaths of these COVID-19 positive patients who became critically ill and died? No answer has been forthcoming. Where did they die? Did they die at home? How many? Particularly over May, June, and July 2021, and still continuing.
How close is the ministry to having enough data on the number of deaths from the HDU and ICU to be released to the public? Because we've asked about this before and we keep being told that the data is being collected.
With respect to HDU and ICU, that is the information that is being compiled. It's something that's being worked on, and as soon as that it reaches a state of completion, that's information that we'll be able to share.
Thousands of citizens in Trinidad and Tobago have been asking these questions. So instead of these 3 doctors on a daily basis standing before the television, talking and having political platitudes and so on, they should do the research work and present that information to the population. What is the mortality rate in the ICU and HDU? Because people want to know if when the families go in there, is there a chance of them coming out alive? They will not tell the population that information or give them because they know that we are one of the worst in the world in terms of management in the intensive care units and ICUs. These doctors who come out on a daily basis and make these statements, they must be removed and replaced because they're not doing what they're supposed to be doing. They are public servants and they must be accountable to the population. The population pays their salaries. And they can't come and be platitudinous to the political party and the government in power just because they sit with the Prime Minister and the Prime Minister's team. They are professionals, and professionalism must be their watchword. And so therefore we demand important information from them.